Hi, everyone. Want to welcome you to this week's podcast. Very excited to have a special guest in our studio. We have Shub Debgupta, who is CEO with Predict Health. Shub, it's great to have you. So glad that you got to join us and looking forward to hearing all about what you're working on and what you're doing over at Predict Health.
Great. Thank you so much for having me. I'm so excited to be here. Thank you.
So, why don't we start off with just talking about what Predict Health is working on, what types of things that you're providing to clients?
Great. So just a quick introduction about Predict Health. We started Predict Health actually based on a personal experience. I finished working, so my last company was called Wiser Together, which was a patient behavioral navigation solution built off a patients like me model, and cycled off the CEO role. We sold the company and we were looking at what's the next step. And I observed my father interact with the Medicare health system. And it was an odd and awkward and unfortunate experience for everyone. So he was buying, actually rather being sold a Medicare plan, and it was through a broker, and it was a rather aggressive sale. And it ended up being rather a terrible experience for my father because some of the information he didn't fully understand or was not shared in the way that he wanted it. It ended up unhappy with the experience and surprised with some of the costs that came through. So he cycled out of the plan. The broker lost money in referral fees, word of mouth, and the plan, just the way the economics works, was lost money on the entire deal. It was an unfortunate outcome for everyone. And in fact, everybody lost money in the whole process. So that got me thinking that this is a problem that could be potentially solved with a little bit of more and better information for everybody. And if you can address that, you'd be able to solve the problem for something like this that happens millions of times a year. But now in Medicare, about 65 plus million people are in Medicare eligible every year. It's half of them, or more than half of them, are on Medicare Advantage plans. They have to cycle through a broker relationship sometimes, and if done well, it can be a very positive and effective experience. And now that you have good data and information, can that be improved? And for the remaining folks that don't have a great experience. And so that got us thinking about solving this problem is really bringing in the understanding that other retail businesses and digital businesses are using, really a better understanding of the consumer. And you bring that to the plans, to the brokers, and all the part stakeholders involved. So that's how Predict was formed. We decided to first test the concept and determine whether this actually works. We did a controlled experiment with a client, and we saw a highly effective, high ROI result, which we'll talk a little bit about later, and proved that this actually works. And then we started scaling it out to plans. So this is so what Predict does. Predict is a member intelligence solution, is a member intelligence company, and we work to really understand the member, both in what they're saying and what they do, and really use that intelligence to predict their behaviors and actions and make it actionable back for the plans to improve their performance, their operations, and outcomes, as well as the member experience. We specifically help plans on the retention and acquisition of members, improving the experience, the Medicare experience, and member experience for the individual, and help with regulatory compliance, as there are a lot of requirements around member feedback and member input, and using that input effectively. So we help plans with a whole gamut of activities from stars improvement and HEI, health equity improvement, and really by better understanding the member and making that a really key part of their operations.
And so, when we think about all the changes that have gone on, and even you mentioned about member, satisfaction and quality improvement, and even for risk adjustment, member stickiness and members being happy in their health plans is so important for health plans to be successful. And you want patients to take up and do the things that you need them to do in order to, again, be good on performance. But that performance really is a demonstration of success. Can you go into a little more detail about the types of things that you're finding, how you're able to put things together? Would love to hear some use cases if you could give us some specifics so that folks can visualize how you're doing this.
Yeah, absolutely. So one of the findings that we've seen across the board is that while plans have some information about the member, be it through surveys, be it through some of the requirements that that they collect data on, they definitely have a lot of information about the health of the member, but little about the life of the member and how they make decisions, and really putting that health in context to their situation. And that's really important. And that gap that plans have is actually hurting them quite a bit, because if you don't fully understand the individual, how they're making the decisions, how they're acting on the decisions, what's limiting them, what's not limiting them, what's making it easy, what are the resources they have at hand, it is very difficult to build effective plan designs as well as serve the member more effectively. And this is a challenge that plans have. They've struggled with this in the past. And while they've made big strides, it still is a huge opportunity. What we're seeing now is plans that have taken some steps to address this gap in understanding of the member are actually performing a lot better. You see this in their star scores. You see this in their quality scores and the health equity scores, as well as their growth numbers and their profitability. If you're able to understand your customer, understand where they're coming from, and be able to meet them and help them improve that situation, you are that much more effective in improving the outcomes that you care about and the outcomes for the member. Plans that aren't able to do that, and this is unfortunately a large swath of plans, and they're still working through the needs, is that they're struggling against high performing plans. And one of the reasons we've seen, if you look at just stars ratings over the years, if you look at health equity scores across the years, high performers tend to stay high performers. And that's one of the reasons they have, is they've figured out a way to understand their member, create operations that meet the member more effectively and meet their needs. What Predict Health is able to do is really write that gap, fill that gap by leveling the playing field. We're really focused on recognizing that members are not the same. Every member has a different situation. They have their own voice. There's opinions and feedback they have. You have to put that in context around their situation, their actions that they take, and that's why I have to really need to understand them at two levels. One is really what they say, what their feedback is. I really understand what they're saying at the core level, and really understand their behaviors and what they do. And only combining the two, you're able to really address this issue and get a better understanding of members. The Predict Health is able to do that for plans at scale. And what we've done is really collect this data outside of a plan's behavior, of a plan interaction. So we're always collecting information about the member. They are putting out digital data. They're putting out streams of information when they move, when they don't move, all information that's helpful for us to understand the constraints that they face, the challenges they face, so we're able to serve them better. The problem that we're solving for the plans is by addressing this gap, you're able to predict and identify what's coming up for the member and be able to tailor resources for them. For example, we're able to identify a use case that we have is retention. So retention, members now have a lot of choices. The average member in Medicare has about 43 plans they can choose from in every market. And this is a national average, and it's the same in 23. It's going to be the same again in 24. 43 plans to choose from is a lot of options. The one thing that's we've seen is also technology and post-COVID has improved the experience and made it much easier to switch plans. This is a structural and technological change that is really core of the industry. If he wants to move, they can absolutely easily do so pretty easily. And many members are doing, if you're in a dual eligible plan that allows you to switch once a quarter, many members do that. It says one of the highest churn rates. If you're in Medicare Advantage plans, open enrollment is coming up, and then you have another OEP, open enrollment in the spring. We've seen, and just looking at 22, 23, and then we predict 24, about 1 in 5 members will voluntarily disenroll. So there's a large number of people essentially choosing to leave the plan and stay in the same market, not moving out of geographies or moving out of plan coverage areas. So they're actually choosing to leave the plan. That's a big hole for a plan to fill if you want to maintain your membership, if you want to grow your membership every year. So 1 in 5 will walk out of the door. And a lot of this is unfortunate.
I would love for you to predict or tell us why. What is it that you're seeing in the data that indicate making this choice?
Yeah, so people are leaving the plans for a number of different reasons. It is, all the way from price sensitivity. So there's a surprise in the plan, the cost of the plan, even though they may be zero cost plans when you come in, the cost structures when you do engage with the plan or use the plan, that may be a surprise or maybe different from what you expect. So there, price sensitivity is one issue. Customer service is a second. People react to customer service experiences differently. So their experience, two people having exactly the same experience may actually have different reactions. Some may leave and some may not. So you really need to understand the individual. So variations in customer experience is a big driver. Provider change is something that we're seeing has a massive uptick in the recent past. With the number of changes of providers and networks, provider systems and networks changing, we're seeing correspondingly the number of members leaving either to go with their providers or adjusting because of access issues to be on the uptick. There are several other drivers around economic shocks. So if somebody has a change in their situation, income, a loss of a partner, or change in their partner situation, that could be an economic shock that drives certain behaviors or retention, likely to churn. And then the last one is also a health shock. So if you have a change in the health situation that is unexpected, or your current coverage doesn't cover it as well, you could be wooed, or you switch plans for the new situation. These are just some of the few reasons that we see. By understanding, predicting these behaviors, and everyone is slightly different, and understanding why somebody's looking to leave and when are they looking to leave or will leave. This is information that can be predicted using the Predict Health solution. You're able to really have an impact. So what Predict Health is able to do, and you'd asked about the use case, is we are able to help plans improve their retention numbers very in a much more precise and targeted and proactive way. So instead of waiting for somebody to leave and learn why they left or why a population left and then making changes, we're able to identify really upfront, essentially from day one, when somebody joins a plan, if and when that member is likely to churn in your upcoming year. When in the year will they churn? Is it 30 days, the next 60 days, next 90 days? Is it next 180 days or an open enrollment? Or will they stay for multiple years? And then why? What are the reasons that they are more sensitive to? So you, as a plan, can react much more proactively. So understanding a member for example, a member is high likelihood or is a high likelihood for a price shock, a change because of a price shock, and they're likely to change the next 30 days or 60 days. That puts you on, you're able to then provide a different level of service or engagement, an onboarding path for the member. So they're aware of educate them on whether there's a price shock coming or maybe a deductible reset that happens, make them aware of it, make them aware of some of the resources that you may have as a plan, and be able to then support them if they do call in a much more appropriate way. Doing so proactively helps educate the member and is able to create a lifeline, a much more happier, satisfied, and engaged member if you proactively engage them at the get-go for what matters to them. As a use case is really being able to understand your membership, understanding where the risk lies, and then be able to tailor your outreach and retention resources appropriately. There are folks that are at risk of churning in the next 30 days or 60 days, being able to target them early with your resources, tailored to their specific upcoming sensitivities or needs, and then being able to keep them and retain them across the year.
Yeah, I was going to say, I think that's fascinating and so important, especially just having that forewarning, right? That opportunity to do something where you can interject and possibly intervene and have a different outcome. I know that this could potentially be superfluous because plans in different geographies may have different reasons, but just two questions I'd like you to elaborate on, and then please continue telling us. Is there any particular trait that is more sensitive than others? And then part two or part B of the question is, do you find any geographies in particular are more impacted than others? Just curious.
Actually, this is really interesting. It's a great question because our population in our plans have over the past few years have diverged significantly. There is very few plans that have a very membership. when you look at the growth of plans, well, Medicare Advantage has been growing rapidly across the past few years. The growth has been coming, and the demographics have been has been growing. There are 4 million people retiring or becoming Medicare eligible every year. But we have, as of last year, have crossed the peak growth for the retiring population. So growth coming in the next few years is going to be growing at a lower clip, while the projections still say that Medicare Advantage eligible population is going to be pretty large. It's going to grow from 65 odd million today to about 80 million at the end of the decade. Growth is going to slow year over year. That growth, though, in Medicare Advantage is really coming from growth in markets that are no longer urban and suburban markets. So we see Medicare Advantage growing, growth coming from populations in more rural areas, exurbs or outside beyond suburbs, and different types of markets. Also coming from different segments of the population, and so minorities, populations are are entering the Medicare Advantage population and market. And so when plans are looking to solve or address, create their service and their experience, create the plan designs, create how they serve and engage with the members, they have to move away from a one size fits all approach to a much more targeted, segmented, and even a tailored approach depending on the population where they're serving. So to your point, what we do see is your question. What we do see is when you look at churn of a population or retention, a lot of the churn is coming from newer members, people who've just joined the plan and are either surprised by it or not. New members, there's a growing silent lapsers, people who will join a plan but will leave without engaging the plan at all. Will never call in and share either their frustration or provide their feedback. It's something that missed expectations and they have other options, so they'll switch right away. That's devastating because if you think about some of the costs associated with acquiring a member, if you have that a customer acquisition cost some of the highest right now, if members walk out of the door right away, that's a huge loss. We see an uptick in lapse rates. I was talking about 1 in 5, but if you look at lapse rates for minorities, for new members, for non-native English-speaking membership, you see the lapse rates the churn numbers to be much higher in high 20s, low 30s rates as well. And this is a real challenge for plans, even though they provide resources. You have language interpretation sensitivities. Being culturally supportive and sensitive in certain markets and more generally is really important. And also what we see is churn in high value members. Traditionally, people who stay on in your plan tend to be tenured. There was to be in the industry, people say if you stay on after 2072, the age 72, you tend to be a longer tenure, you stay on a longer plan. That's no longer the case. We're seeing a churn in your high value members, and that creates a double whammy because you really have invested in the relationship. It's something that you would want to build and maintain. So being able to take a much more proactive and more precise view on how do you engage, support, and retain these segments of your population of this membership is absolutely important. And you have to go beyond just data. You have to really understand. You talked about geographies. You have to really understand the challenges on the ground, because a lot of the issues that come up is while you may have rich benefits, it may not apply. The benefits were designed for the entire contract or the entire plan. They may not apply in certain segments of the population or certain nuances of the geography. So you really need to go beyond what potentially an aggregate survey would say or data feeds would say to really understand what the voice of the member is. And this is where Predict comes in. So we offer really end-to-end advisory groups, smart advisory groups. This is next generation of advisory groups to pull in segmented, targeted members that are relevant for a particular issue that's representative of the market or the issue that you're looking at, and be able to go into a specific geography, a specific measure at the STARS measure level or the health equity index measure level to really understand, or even at a benefits level to really understand what the challenges are. What's hear from the member in their own voice? What are the issues? What are the holdups? So one example is that one of our clients has very rich benefits in the market. And they tested actually they were testing really high in terms of the value score. However, nobody was using the benefits. This was a transportation benefit, and especially the specific segment of the population that was socially vulnerable were not using the transportation benefit, the rich transportation benefit. So this is where our solution was able to pull a representative group together very quickly, be able to engage them, collect the data, and really understand the nuance of why we were able to identify the specific how the benefit was positioned and how it was communicated out had real challenges and it causes problems. So the plan was able to address that quickly in year and be able to see an uptake in utilization and uptake in access, which was really the limiting factor there, and have an impact on that segment. And
I just wanted to was going to say, I'll just underscore what you said because working at risk bearing provider groups, I was at one. We had 100,000 Medicare Advantage lives with 13 different health plans that we had global risk contracts with. And on average, we would lose 10,000. We would gain 10,000. We would lose 10,000 members every single month. And it wasn't like they popped up elsewhere or they moved from one plan to the next. The providers, the network was generally stable. It was a really interesting phenomenon. And then the other thing, just to again underscore what you said and the importance around this work, we would find that usually new patients within the first 60 days were the ones that, when you look at the population of who was the most expensive, they were the ones that had those catastrophic events. So they were before the March deadline, right? Where you were worried about membership settling out. It was within 60 days. So it was really hard to get the annual wellness exam on them to be able to capture risk or other types of things. And so they were coming into the plan and then causing the greatest expense. You mentioned about rich benefits, and I'm actually going to be at there's 3 conferences happening next week, our member experience, the bid boot camp, and then the Part D summit. And would love to hear, your thoughts, just hearing about the benefits. I know some of the strategy of plans have been, given the recent changes in regulations, has been either cut benefits, right? Some of them have gotten out of Medicare Advantage altogether, but cut benefits, have these bare bone plans. Other strategy has been around throw everything into it and have these super rich benefits. Curious based on your experience, and I do want to talk a little bit more about the advisory groups that you're able to provide that service, but would love to hear you talk about what you were hearing around benefits. I think it'll be really important for those that are going to be in attendance at this bid boot camp of how they might be thinking about plan design going forward.
so the world has changed. It's as reimbursement rates have been under pressure and growth at all costs the mindset has changed for plans, just moving away from a growth at all costs. We've seen several, both large and small plans rethinking how they are growing next year. And even today, there was an announcement from Centene that they are rethinking how many markets they will be in. It comes down to how they think about allocating those limited resources they have, even the shrinking resources they have, most effectively for their population. So there are 2 real approaches. The one size fits all approach where create the most generous plan as possible for as big a group and we'll figure it out at the end is probably not here to stay long. You really have to think about how the plan is tailoring to your core market or the market that you want to retain and attract as you maintain your plan. So benefits has to be more tailored to the population, and benefits is not sure is an economist's dream. It's all about incentives. So is how do you align those incentives for that population? So you really need to understand that group in a much more detailed way. So the challenge that plans are going to have is we think actually plans are going to increasingly move away from this rich bundle of benefits and have as big a group come in to much more nuanced plan designs that are tailored for your segments. Maybe there's variations within a contract and so forth. The plans do have an unenviable position right now of having to move from where they are a year or 2 ago, where you had the richest benefits, to now how do you shrink smartly or adjust smartly? it's really hard to take things away. But you have to do it smartly and really and it has to go beyond just a value judgment. So when you look at the actual models, of how do you look at the value of a plan? So you look at the total value, and the studies that plans look at is what is the value that members place on it. You have to really think about what is the utilization as well and of the members. So does the value of a generic member or an average member mean that it is the same across all segments, or really which groups are we going to look at? So this is where taking advisory groups, or even looking at small group analysis to really understand how each of them would react to the upcoming or potential plan designs, how they would rate it or weight it, matters. As an example, I wear glasses, and if you look at the vision benefits, everybody values it pretty highly, but it's much less for folks who don't wear it, is how much they would utilize it differently, don't wear glasses. And so really understanding those nuances is pretty critical. And as the populations have become more diverse in a market, a specific bundle of benefits, those will work the same. So taking it to that next step and really understanding how subgroups look at it, the advisory groups could really assist with that. How they would, if they have that benefit, how would they react, or how would it affect access issues? How would it affect their own care, their quality, and their ratings of quality measures? Would they go for having the transportation benefit? Would that help them attend doctor visits? How far would they go? Understanding that at that level is absolutely critical to designing an effective plan, because it goes beyond, because designing a plan goes beyond just the plan benefits. It's really how people will view it and how people will use it.
Well, and advisor groups now too are part of the requirement, right? I know that we were talking about that before. Maybe you could talk a little bit more about that for those that then maybe don't have an understanding of advisory groups and their purpose and so on and so forth.
Yeah, absolutely. Thank you. The advisory groups is really a way for capturing member voice. So it is really understanding the member and understanding the member's feedback around specific topics, issues, and really empowering and capturing their voice and using it in your plan operations, in your plan governance, in your plan strategy. Different plans have done this, not just in Medicare, but Medicaid has done that historically on a voluntary basis. Often the big national plans would have organization that collects such data. Smaller and newer plans and struggle with that, and would deploy it on a more for sales, but not for plan operations. And so once a member comes in, really, how do you utilize the plan and improve quality and health equity measures? So that was a real challenge. And CMS took this up upon themselves to recognize that this is a critical gap in that plans have in the understanding of members and member issues. And so they systematically created programs, and they're rolling this out pretty rapidly across all plan types. So it started with the PACE programs in a small market, in the PACE programs and the LTSS programs, where they required what was called advisory groups. And I know some states have in the Medicaid space as well, it's advisory groups, but there's no consistency or requirement. But in 2023, CMS rolled out, expanded this coverage of requirements around the PACE program because it's very successful. Very quickly, they rolled it out to all dual eligible plans, saying that you, as a dual eligible plan, must set up what they call enrollee advisory committees, member advisory committees, to systematically collect input from the member about their plan operations, their plan experience and feedback, and use that to improve plan operations and plan governance. These plans had to do this very quickly, and they have to now implement enrollee advisory committee for every state, in every state of operation. So if you are a plan that has operations in multiple states, you have to maintain a representative enrollee advisory committee that's representative of that population in that state, in every state of operations. And this is pretty challenging. And actually, it's actually really clever from CMS's side, making it a requirement. So it's really leveling the playing field, saying this is important. You have to collect this data, and not just because the big planners do it, or some plans do it and others don't. It's really, this is important for improving the quality of care. And this is, if they've got data to back it up, is when you have these groups, you actually have a better experience for the members. what the challenge that plans have had is how do you first understand what's representative? How do you pull that group together? How do you manage? How do you manage? You set one up. How do you manage it? How do you collect the data? How do you prioritize the insights? And how do you then use the insights back in the plan? And so this is a pretty hefty lift for every plan. If you have multiple states, it's even harder. And this is where Predict Health comes in, and we help plans of all sizes, all the way from regional integrated plans to blues to large national plans covering dozens of states. We're able to support end to end, all the way from if you want us to run your entire enrollee advisory committees and member advisory committees, we can do that all the way from member identification, panel recruiting, panel management, then meeting management itself, collecting the data, which is really important, making sure and ensuring that data is representative of the population, because that gives you confidence about how do you then use the insights, pulling out insights and then sharing it back with the stakeholders and if it was CMS compliance and regulatory compliance needs. That's for plans that require such help. Often plans have their own resources in-house and be missing. A big challenge is really the identification of the members. So which group or which panel, how do you put a panel together that's representative of the question or the issue that you're looking to address? And this is where we bring in our intense data analytics. We have insights on every member in the eligible member of the country that we're always collecting, that we're able to bring to bear very quickly, allowing you to pull together what's the representative group, sample for your question, but also what's the largest support group. Should people churn or how do you keep this people cancel? How do you bring that group together and maintain it? Panel management, so we can do the identification, the recruiting and engagement, the panel management, and then working with the plan. If you're collecting or managing the meetings itself or events, we're able to support you on that. And then key is how do you then prioritize, understand the insights, capture the insights, the feedback, see patterns in the feedback, prioritize that, and then share the organization. So that's we work with the organizations on that. And now we're also introducing a very cool software technology that allows you to run this at scale. So this is where teams can take this technology and really build this internally. And this is really going to help. CMS is now adding additional markets for advisory groups. So Medicaid plans are requiring it. We expect them to expand this to other parts of Medicare as well. And many of our clients are saying this has been so effective. Can we apply this for health equity? It is part of by the way, it's part of the health equity accreditation process as well, having and maintaining these enrollee advisory and member advisory committees. So anybody thinking of their health equity strategy would need to put groups like this in place and manage it. It's really important how you manage and build that culture of continual data collection. This is all that's our Predict Health supports, and we've been very successful at doing so.
Absolutely agree, and think it's so important. Would love to hear either from experience what you've heard from your team and those that are working with some of your health plan clients today, knowing that there was success, as you said, in the PACE plans and in Medicaid, and now it's been spread more widely to other populations. What are some of the either maybe you could remark on some specifics of either changes that you saw plans undertake because of the results of the data, or maybe trends or patterns that you were able to understand or see, identify in the data that you found surprising? Anything there to share with us?
Yeah, definitely trends around health access. So some of the challenges around health access. So either through transportation is one that is recurring, especially for some segments of the markets. We're able to identify what aspects of transportation or access is a challenge, where the benefit falls through or the coverage falls through or is sufficient. So access is one. A provider networks. There tends to be there's some changes in provider networks. How do you bridge that gap? We've seen plans learn new nuances because whenever networks are changing and they're doing more often these days, how do individuals cope with those changes? Understanding that at the member level is really critical to help you build your strategy and your communication front and re-onboarding for your new member. How do you help people transition from provider to provider? That's really critical because those are high value creation or value loss moments in their relationship with a member. Supplemental benefits is a really big deal. I know in the last few years, there's been a real step up in the amount of supplemental benefits that people are offered. Not all are used. Some are more for attraction or sales, as CMS has noticed. But a lot of the benefits that are offered, how they're viewed back by the membership in terms of not just at purchase or at sale, really during an ongoing basis. How you stay top of mind, how do you use those benefits when you need it? That's really on the utilization and benefits activation side. That is really those insights around that. Language issues. We've seen plans have been blindsided by the language needs of members in certain markets, recognizing that you may have acquired a market or inherited a plan and realize that, yeah, everybody in the application form checked English as one of the languages. So it's an English speaking majority plan. Often that's not the case. And we've seen real world examples repeatedly at our client side where they're surprised by what a large percentage of their population speaks or needs communication and support in other multiple languages and cultures. And this is where I can rattle off specific markets where you really want to go in and think about what's my alternatives, what's the second language or the third language that we support, and how do you make that front and center in your communications and outreach. And those are all very critical in how you drive that ongoing engagement. The other area that we've seen plans really benefit from, especially on the advisory groups, is really on the onboarding. What do you share and what information you provide, educate members upfront on how do you build a more effective experience? Because it is always, no matter what which plan you come from, or even if you had the commercial plan before your retirement and now you've moved into your Medicare Advantage plan, the fact that it was an Aetna plan before it's with your employer and now you still have an Aetna Medicare Advantage plan, it's not the same. It's a completely different experience, and being able to educate the member that of the differences, the changes is absolutely critical. So how do you onboard them? How do you educate them? How do you provide the resources on demand? Because you can't provide everything up front and they may not be ready for the full education, but really how do you provide those resources when needed and support them on those interactions? That's been absolutely critical. And we've seen that to be very helpful, precise on a market level or the segment level and the population level to be able to improve value across the board.
Even running operations in the field with patients in different neighborhoods can definitely agree, right? Have had the experience that you mentioned where how we ran health fairs might look different in Northern California versus Southern California because of parking availability, or to your point about language and culture and how folks might be receptive to home visits. Do you mail? Do you make a phone call? And I think that insight and is so important. You mentioned about, and I don't want you to reveal any secret sauce, but you've mentioned many times about predict being scalable. Can you talk about what that means and then help us visualize what that might look like for anyone who might use your services?
Yeah, absolutely. The core of what Predict does is based on our rich data set, rich understanding of our members. So we built an understanding of 180 million members, eligible Medicare and Medicaid eligible members today. And it's really understanding them we call this a 360 view of the member, is really understanding them at their situation, environment level. So what are the social determinants of health, of their addresses, where they live, what are the constraints they face in their neighborhoods, in their zip level, at the address level. Their consumer preferences, so how their buying behaviors, how they typically like to buy, what are the challenges they face, how they make decisions, really understanding them. This is information that we've been able to garner, as well as their communication preferences and plan preferences. So what do they value in plans? Things that could be gained from their past experiences that we've been able to put together. So you really have a very rich understanding of the member going in. Using that data with machine learning, AI, and deep analytics allows you to predict behavior, and we're able to predict at the member level. So if you have a specific individual, we're able to say these are the challenges they would face. This is really take retention, for example. This is the risk that the member would have. These are the sensitivities that they have. If you want to improve their experience. Using that allows us to really scale both from really regardless of the size you are. So if you're a small plan in one county or in one market, we're able to put together an understanding of your members really from day one. So you have new prospects coming in on Jan 1. How will they like to engage? What are their preferences? What are their sensitivities? So as you plan your onboarding, you plan your engagement, we're able to take it to, if it's 5 or 10 members that are joining that county, you're able to get it at that level. To if you're, as I mentioned, Aetna or Centene, you have tens of thousands of members joining a specific market, we're able to then build that all the way up for every individual in that 10,000. That allows you to scale as pretty flexibly. The other part of the scaling is really the technology and the tools. So we've talked about we're releasing our, especially the advisory groups, we're not only data driven, but it's heavily technology and software built as well. So if you want to run, for example, if you want to run your advisory groups and pull in the representative members, our technology will allow you to do that. So you can leverage that technology. It's data. It has all the tools that our team would use and uses as well. So one example about scalability is if you're putting together, if you want to study a topic or you have an issue, be it stars. Stars is an area that actively uses and needs advisory groups to really break into the nuances and challenges that why certain measures are not moving despite your investments. For example, who are the holdouts and what are the challenges they face? If you want to pull a group together on a specific measure, how do you know it's representative? How do you know that those are the individuals that have the challenge? And do they speak for the group? Our data allows us to do that. So we have scorecards that allows us to understand if you bring in what is the target group out of your population. So if it is 100,000 in your market or 100 in your market, who are the 5 or 10 members you should bring in that would be representative of that issue. And facing that issue, we'll be able to give you a representative feedback around it. So you'll be more confident to use that action and use that insight to solve the problem, not just the loudest voice or whoever walked into the door. Because that's a big challenge with market research is you have a focus group that just 5 people walked in. You have no idea whether that's representative random or which is what statisticians like, and then be selected, or just the 5 people that is biased. And so that always limits the actionability of the traditional focus groups and some of the market research that's done. Ours is really adding a lot of science and data behind that, allowing you to build these representative groups and make it a lot more actionable as a result.
I love that. I love how we started with a very personal story and recognizing something that needed to be fixed, and then being able to use data so discreetly that you can be proactive, as you said, and approach members in a way that's authentic and meaningful. And it's going to be so important with the changing landscape in healthcare, as well as the advisory groups that you're able to put together. Again, so important to make sure that plans are providing the services and the benefits that are important to members. Given all of that, would be curious to know, what do you see as being in the future of Predict Health? Where do you expect things either for you to go or the landscape to go and possibly change in, say, the next year, 3 years, 5 years?
Trend that we see, and this is accelerating, is that members are going to be more in charge. They are making decisions increasingly. So you can look at the pre-COVID, post-COVID, the tools that are being made available to them, and the trends that CMS is on a path forward is really around the member has and needs to be empowered. And you're seeing members actually take that power and make decisions as a result. The people retiring today or becoming Medicare eligible today are very different from even 5 years ago or 10 years ago, because they've been, for example, they've been on the internet all their professional lives. And they have a much better understanding and similarity with technology and tools, and they deploy it and they use it. And that gives them, and we're seeing tools improve, it also increases their decision and actions that they're taking. So the trend that we see is really a trend of empowerment, and where the patient or the member is actively in charge and making decisions of how they're navigating their plans, using their benefits, and acting upon it. And acting means both in utilizing the benefits to its fullest or to their needs. And if they don't get the experience that they want or they expect, they will leave. And this is a real challenge that we will see plans having to change. You cannot hold back. You cannot constrain the market anymore. CMS is really limiting that. How you communicate, there is how do you market. This is really leveling the playing field, both for small plans, big plans, removing all the barriers around any friction that was in the market. So you're going to see members make decisions and act on them, and plans who can understand those decisions, support the members, and build a better value proposition for that relationship. Be it members in a urban suburban market that they traditionally serve Medicare, to the new members emerging, maybe speaking multiple languages or different languages rather than English, or in rural markets, non-traditional Medicare Advantage markets. They all have to be served differently but effectively. And how do you modify your approach to have these multiple approaches and still be profitable and still grow and still serve the members in an effective way? That takes a deeper understanding of the individual and much more deeper understanding of their constraints, because knowing a member, knowing how healthy or unhealthy they are is one part of the equation. You really need to understand how that decision or actions are taken in the context of the individual. Understanding the context is where the opportunity is, because that allows you to then predict their behaviors and the future. This is, if you want to win in an empowered market, you need to be able to understand and predict, get resources to often use terms where the puck is going, where are members, what are they going to do, and be able to deliver that value at that moment very quickly.
100%. So much great information and very exciting about the work that you're doing and think it's so relevant and timely. Is there anything else that you want to share with us today that maybe we didn't cover and you wanted to talk about?
No, thank you. First of all, thank you very much for the time. Really enjoyed our conversation. I think the critical aspect that all plans are struggling with, all the way from the CEO and the market leaders and the C-suite down to the care managers and the frontline employees, is really how do you serve the member more effectively, and how do you help the member at the time of need? And this is where really a better understanding of the member, both of what they say, their member voice, capturing that and understanding that, as well as understanding their behaviors, their actions, and then learning from it and being able to develop programs, policies, and designs, benefits designs for them is going to be critical. And that's front and center for plans in the future. We fill that gap where we help executives as well as all the way down to the frontline employees at plans really understand that, to understand their members at scale, individuals, and do that across markets and at scale, and deliver real impact back to in terms of retention, acquisition, growth, profitable growth for a plan, as well as being able to improve your key measures around quality measures, stars, and health equity index measures quickly and effectively. And we're growing, working with a large number of plans today, covering about 5% of all dual eligible members, and growing. And would love to share our solutions and our work with you in more details. That's the one thing I like that.
Fantastic. Thanks so much for sharing your time and telling us a little bit more about what you're working on at Predict Health. Thanks so much, Sheep.
Thank you so much, Anne.